Hey guys, my name is Kels, and in this video, I'm gonna share with you guys about how I got COVID-19 for Christmas. Yay! And we're gonna discuss about how I got infected with COVID-19, my symptoms, and some tips on COVID-19 diagnosis and recovery. So, how did I got infected with COVID-19? Ever since when COVID started spreading in the States, I never got infected before, even though I was an essential worker and I had multiple coworkers got infected with the virus. Everywhere I go, I always wore double mask. I change my mask every 4 hours when they get wet, when I talk too much, after I eat and all that. And I thought that because of how careful I am, I never get it until last year, around 2 weeks before Christmas, when my mom's boyfriend came back to the States from Norway. At first, when he came back, we were very, very excited since he is the driver in the house and we can finally go out and shopping without using Uber. However, right after he came home, he started experiencing sore throat and coughing, and he took an at-home COVID test. Turned out he was COVID positive. As soon as he tested positive, my mom and I tested ourselves, and both our tests came out negative. And we started socially distancing ourselves from him immediately. We stay out at our room most of the time. We cook and ate separately, and we thought we didn't get infected because we didn't experiencing any symptoms, and but we decided to schedule the PCR test from our local pharmacy anyway, just to make sure. And during this time, I also went to work, which I probably shouldn't. I did tell my co-workers and my manager saying that I had a close contact with somebody with COVID-19, and then they said it's okay as long as I tested negative. So, I thought I was fine. After my second day of work, I started experiencing symptoms, and some cold-like symptoms specifically. I felt a little bit chilly, like the feeling when you feel like you're about to have a fever, but you didn't. Yeah, that's when I felt. I thought because of the weather was getting cold, so I took a Dayquil and Tylenol, and then the chilly feeling were gone. But then the next day, I started coughing up mucuses, and the coughing took forever for me to recover. My mother also experienced similar symptoms. And then soon, my mom's boyfriend received a phone call from the Nevada National Health Line, informed that my mom was tested positive for COVID. And as I was trying to recover, a couple of days later, I received a text messages informed that I tested positive as well, and I called off from work as a result. So, what were my symptoms? All of our symptoms were very, very mild. I think the reason because of that was that we were fully vaccinated. I was vaccinated with 2 doses of Pfizer and the Moderna booster. My symptoms were coughing, sore throat, eye pain, and fatigue. It took me around 10 days to recover, and I recovered the day after Christmas. And how is COVID different from the common cold? Well, I fucking hate getting COVID-19. Although my symptoms were mild, it took me forever to recover compared to normal cold. Usually when I get a cold, I get a cold as soon as the weather gets cold. It took me only 3 to 4 days, and I feel like nothing. And for COVID, it took me more than double the time for me to recover. And every freaking day, I just coughing in my room, taking Dayquil, feeling tired and sleepy all day and all night like a freaking pig. And the worst thing is that having to cough multiple days and missing paychecks And there's absolutely nothing I can do about it because of, I got positive. I shouldn't spread it to other people. I don't want to cough at work, being the virus. And every day, it's a long, never ending day waiting for the coughing just to go away, waiting for I stop coughing on mucuses and able to go back to work again. And hopefully, I don't get fired for calling off. And how to diagnose yourself for COVID 19? First, if you live with somebody who has diagnosed with COVID 19, there is a very, very high chance you may have it as well, regardless of how careful you are. Um, Even though, after you tested negative, which is like what me and my mom did tested negative, it's make sure to test it again either at the at-home test, when you're experiencing symptoms, or go to a PCR, get a PCR test in your local pharmacy. Chances are the testing kit may not detect the virus when you're asymptomatic. You may be incubating, and this is the case for me and my mother because of we only tested positive when we are experiencing symptoms, and when we were asymptomatic we tested negative and we saw we didn't have it, but we did. How to prevent yourself and recover from COVID-19? First, get fully vaccinated, which means at least 2 doses of vaccine and at least 1 booster. And even though all of our symptoms were very, very mild, we understand this is the exact same viruses that put so many people in the emergency room, made healthcare systems globally collapse, and killed millions of lives globally. COVID-19 killed my grandpa. He was not vaccinated. And thanks to how hard health officials worked on the vaccine, we are lucky that we didn't have to be on the ventilator. We were lucky we can recover ourselves at home. We are lucky and thankful that our symptoms were mild and we still had our taste and smell, that we didn't lose it the whole time when we were positive. Number 2, always wear masks, especially in crowded public areas. I know for now, mask is not mandatory in most places, but COVID-19 is still spreading. We got COVID-19 for Christmas. People are still getting infected and coughing in my room, having to skip so many days of work, suck ass. Wearing double masks for me was able to prevent myself from getting COVID-19 for 3 freaking years, even during the pandemic at the peak. So I suggest that you guys do that too. I only got infected because I lived with someone who was infected. Before that, I didn't. Number 3, always stock up on cold and flu medication. They are going to help you feel much better when you can recover on your own, but taking the medication is going to help you feel better and recover quicker. Right now, the brand Kit Tylenol is out of stock in my area. So I suggest you guys get the generic brand as soon as possible for your children. The cold and flu medication is crucial on recovering and feeling better when you were COVID positive. If you experience coughing and sore throat, take Dayquil and NyQuil. And if you're start experiencing fever and body aches, take Tylenol. And for eye pain, make sure to put some eye drop. It's gonna make you feel much better. And for fatigue, unfortunately, there's nothing you can do other than wait it out and sleep the whole day like a pig. Number 4, even if you are COVID positive and people who live with you is also COVID positive, still socially distance yourself, quarantine yourself from them as much as possible. do not walk in same areas that are commonly used, like don't share kitchen, don't share living room, and then don't share food. And then that wear your mask if at home when you encounter them. Chances are that because everyone recovered at a different speed, I recovered first. My mom's boyfriend, he recovered second. She recovered last. Everybody's recovering at a different rate. And then if I didn't socially distance myself and quarantine myself from them, I could possibly get reinfected again while they are still recovering. So it is crucial to wait until everyone recovers to get together again. And that's it for this video. I hope my experiences provide you guys with some good tips on diagnose yourself and recovery from COVID-19. Don't get COVID for Christmas. It sucks, and goodbye.